You're all itching again and getting tests that say that you have nothing, no yeast, no infection. So you're told no problem, but somebody just told me that they're itching so badly that they are getting sores down below, and you're not alone because this is a thing. Let's circle back to this one again. Hi, I'm your local OBGYN. I love women. There's a lot of you that don't have all of the information yet again. So estrogen changes, age-related changes, tissue changes of our vulva mean that the integrity and the way that it reacts and you get like symptoms changes as well. And what we know is that there is a low estrogen condition called lichen sclerosus. And basically what happens is when the dermatology condition of the skin in that area starts to vary, you can get this very pale lightening of the tissue around your clitoris, the labia minora. Sometimes it even extends between the vagina and your rectum, and the tissue gets like super thin, almost like rubbery and flat looking. And this is where you can't understand what's going on. And if somebody is not experienced and is looking down there and they just say, hey, you have no infection, then they say, move along, next. But the reality is that lichen sclerosus is a vulvar condition where there is changes in the inflammatory properties and the barrier and the sensations that you have. You may want to feel like you want to scratch the tissue off of down there because it is that terrible. And ultimately, you're going to need probably some very strong topical ointments and then maybe some estrogen back there to kind of like rebuild that tissue intermittently. It is chronic. It usually needs to be biopsied because it does have a slightly increased risk of turning into like a cancer in that area of the vulva. So don't get ignored. You could put a mirror down there. You may not know what you're looking at, but make sure that you have talked to a provider that has a clue of what lichen sclerosus is before they blow you off and say it's just nothing.